Hello, welcome to my presentation about the medical treatment options for patients with schizophrenia. My name is Andrea Clark. To treat or not to treat schizophrenia is the question that brings us here today. Before a determination of treatment can be made, certain aspects must be understood. This presentation will explore the following topics to help us make an informed and educated plan for treatment. Topics include neurotransmitter theory, common treatment drugs, how these drugs affect the brain, side effects, examples of drugs, remission, mortality, the course of the illness, treatment benefits and risks, benefits and risks of not treating with medication, and spontaneous recovery. The neurotransmitter theory of schizophrenia proposes that imbalances of dopamine and serotonin play a key role in the symptom development of schizophrenia. The neurobiological theory states that schizophrenia results from the dysregulation of neurotransmitters such as dopamine, glutamate, gamma-aminobutyric acid, and serotonin. The theory continues by stating neurotransmitter abnormalities include excess dopamine, reduced glutamate in the cerebrospinal fluid, levels of GABA expression in the prefrontal cortex, and reduction in serotonin levels. Glutamate receptors of the MMDA type are responsible for schizophrenia-like symptoms such as hallucinations, out-of-body experiences, symptomology, and cognitive deficits. The neurotransmitters most frequently studied in schizophrenia are dopamine and glutamate. Regulation of these abnormalities lies in the use of antipsychotics. Symptoms that can be relieved by antipsychotics include hallucinations, delusions, social withdrawal, and limited emotions. Blocking dopamine receptors is effective in treating schizophrenia. Common types of medication for the treatment of schizophrenia include clozapine, aripiprazole, and haloperidol. Several common drugs are used to treat schizophrenia, and they fall into two main categories: first-generation antipsychotics, or FGAs, and second-generation antipsychotics, also known as SGAs, also known as atypical antipsychotics. FGAs can be divided into low-potency and high-potency categories. Low-potency drugs like chlorpromazine require higher oral doses to be effective, whereas high-potency drugs like haloperidol work with lower doses. Low-potency medications may cause side effects such as sedation, dry mouth, memory problems, cardiovascular issues, weight gain, and sexual problems. High-potency drugs can lead to different side effects, including acute dystonia, Parkinsonian symptoms, restlessness, tardive dyskinesia, and a severe condition called neuroleptic syndrome, which involves fever, muscle rigidity, altered consciousness, and changes in blood pressure and breathing. Management of side effects involves discontinuing the medication or switching to a drug with fewer side effects. It is crucial to carefully assess the benefits and risks before making decisions or changes in the treatment plan to ensure the best outcomes for the patient. Some commonly prescribed medications include SGAs like clozapine and aripiprazole, and FGAs like haloperidol. Clozapine is more effective than other antipsychotics and works differently in the brain. One difference is it does not block D2 receptors as strongly as standard antipsychotics. Instead, it increases dopamine in the prefrontal cortex, which helps with planning and goal direction. In the mesolimbic area, it inhibits the release of dopamine, which is why it's effective as an antipsychotic. Clozapine has a wide range of effects on various neurotransmitters in the brain, including dopamine, serotonin, norepinephrine, acetylcholine, and histamine receptors. The unique effects of clozapine may be related to how it affects the balance of serotonin and dopamine activity in the brain. This balance is believed to be the key to its unusual effects. Clozapine is effective in approximately 1/3 of patients who do not respond to standard drugs for schizophrenia. Compared to typical neuroleptics, clozapine effectively reduces symptoms and improves overall functioning. It also appears to impact reducing the risk of suicide positively. However, it is essential to note that clozapine can pose serious risks. One such potential risk is a granulocytosis, which hinders the body's ability to produce white blood cells. This condition can be life-threatening, but it can be managed with careful monitoring and regular blood tests. As with many medications, clozapine may also cause side effects including seizures, drowsiness, low blood pressure, drooling, bedwetting, and weight gain. It is crucial for healthcare providers to closely monitor patients and address any potential side effects to ensure their safety and well-being. Aripiprazole, under the brand name Abilify, is a type of atypical antipsychotic medication with a unique way of working in the brain. It works uniquely by interacting with dopamine and serotonin receptors to help reduce agitation in individuals with schizophrenia. It is a partial activator of dopamine D2 and serotonin 5-HT1A receptors. In schizophrenia, psychosis can lead to restlessness and agitation, possibly due to excessive dopamine activity in specific brain pathways. Aripiprazole competes with dopamine for D2 receptors but only partially activates them, which reduces dopamine activity and helps with agitation. Agitation is also linked to the serotonergic system in the brain. Ariprazole's partial activation of D2 receptors and its antagonism of 5-HT2A receptors have anti-agitation and anti-reducing effects. Aripiprazole is an effective and well-tolerated medication for the agitation associated with schizophrenia. It is associated with low instances of extrapyramidal symptoms, cardiac issues, hyperprolactinemia, metabolic disturbances, and weight gain. Haloperidol is a high-potency antipsychotic medication used commonly to treat acutely ill patients. Studies show that when compared to nimonipride, haloperidol was less effective. Likewise, when compared to 19 other FGAs, haloperidol showed no significant differences in effectiveness. It did, however, rate as more effective than trifluperazine on psychiatric rating scales such as PANSS and PPRS. It is important to note that the haloperidol group had a higher dropout rate than the control group using another FGA. Side effects associated with haloperidol include tremors, dystonia, and weight gain. Compared to low-potency antipsychotics, haloperidol showed a higher incidence of EPS symptoms but less sedation and weight gain. Benefits and risk of treatment. Treating patients with schizophrenia using medication has its risks and benefits. Benefits of treating with medication include management of symptoms, relapse prevention, maintaining stability, improvement of social functioning, improvement of cognitive functions like attention and memory. Risks of treating with medication include side effects such as tardive dyskinesia or EPS symptoms, difficulty adhering to a medication schedule, and long-term effects. The benefits and risks of treatment without medication include avoidance of side effects, allowing individuals choice for alternative approaches like therapy or lifestyle changes. The risks of treatment without medication are a worsening of symptoms, increased risk of relapse, social and occupational function, and impairment. The course of the illness. The early stages of schizophrenia, known as the predominal stage, can last several years and have significant social consequences. This stage has two phases: a pre-psychotic phase before the first psychotic episode, and a shorter psychotic phase before seeking treatment. Most of the adverse effects of schizophrenia occur during these early phases. If the prodromal phase remains untreated for a long time, it suggests a more challenging course of the illness. In some cases, schizophrenia may only result in one psychotic episode with minimal impact on a person's life. However, in a small proportion of patients known as progressive type schizophrenia, the illness can lead to impairments in various areas of life. The age at which schizophrenia first appears also influences its impact. Generally, the later the onset of the illness, the less severe its effects tend to be. Treating patients without the use of medication has its risks and benefits. Consideration of the individual's circumstances, symptoms, medical history, and cultural beliefs is vital in treatment decisions. Spontaneous recovery. Likewise, when the symptoms and signs of schizophrenia disappear or improve, it suggests that the patient's condition is getting better. However, in many cases, this improvement may only be temporary, and the symptoms can return. If the improvement in symptoms lasts for an extended period, it is referred to as remission, and the patient is considered clinically well. Patients who achieve remission tend to have better outcomes compared to those who only experience brief improvements in symptoms. One study of patients with schizophrenia found that after 10 years with the disease, 30% out of 496 patients were able to do well despite not taking their medication. Additionally, a Dutch study in 2013 found that a group of patients who received less medicine or stopped their medication managed better 7 years after the experiment when compared to a control group who had continued with the high-dose medication. Rate of mortality when untreated. People with untreated schizophrenia have a similar mortality rate to those who receive treatment. However, untreated individuals tend to have a higher proportion of severe symptoms. In a group of 100,000 patients with schizophrenia, the mortality rate for those who have never received treatment was 2,761. Rates of suicide were not significantly different between untreated and treated individuals, nor was the overall mortality rate. Patients who have never been treated are more likely to be older, poorer, have had the illness for a longer time, and have limited family support. The higher mortality rates, homelessness, and lack of treatment are linked to socioeconomic disparities. Overall, mortality rates for people with schizophrenia are higher than in the general population, and this has worsened in recent decades. It highlights the importance of early intervention and access to appropriate treatment to improve outcomes for individuals with schizophrenia. People with schizophrenia have a significantly shorter lifespan compared to those without the disorder, with the life expectancy reduced by 20 to 25 years. Various factors related to lifestyle choices and comorbidities contribute to this increased risk of mortality. According to a Finland study, regular use of antipsychotic medications, especially long-acting depot formulations, may significantly reduce mortality rates for individuals with schizophrenia. The study found that those who adhere to their medication regimen could experience a decrease in mortality by approximately 40 to 50% compared to individuals who do not take their medication regularly. Patients who may be a good candidate not to be treated with medication are those who are not experiencing many problematic symptoms, has a later onset of the illness, have achieved remission, are well functioning, have family support, or not subject to economic disparities. As stated in this presentation, it is crucial to carefully assess the benefits of risks and making decisions or changes in the treatment plan to ensure the best outcomes for the patient. Consideration of the individual's circumstances, symptoms, medical history, and cultural beliefs is vital in treatment decisions. Thank you for your time. If you have any questions, I'll answer them at another time.